Bonjour, Chukma. Welcome. I am Shannon Beach. I'm a psychologist with the Citizen Potawatomi Nation Behavioral Health Clinic. I'm here with Ricky Wisenhunt. He is a counselor at CPN Behavioral Health and Native Connections Project Director Michael Haskins. And we've been asked today to talk about anxiety and stress that many of us have experienced in recent days and weeks and months, and just kind of how we can cope with some of those feelings. So we'll switch over to our slide presentation right now. Okay. All right. So, again, we are here to talk about how to cope with anxiety. So, as far as everything goes, I mean, the world's just been a bit in upheaval lately. We all have a lot of questions about things. A lot of stressors are going on. Just day to day life, things that are normally stressful. In addition to that, we have all these things on top of it for the way society is kind of interacting with COVID right now. Kind of some of the things that are bringing extra stresses on. We all have these questions like, should I be worried? And you can kind of fill in the blank about what with a million different things. Do I need to stay home? Will all this end? Should I wear my mask? As far as these things go, sometimes we have to leave the home. Sometimes we can see things in sight for the end. Sometimes it's a struggle. Ultimately, though, we don't have a lot of answers that we can say definitively to very many of these. Although I think all of us at behavioral health are going to support the medical community and say, yes, absolutely, you should wear your mask. That's one thing that I think we can agree on for sure in behavioral health and with the medical community that has been shown to reduce the transmission of what's going on. So if we all wear our mask, it can help reduce some of the stress just by what it does for our community. One of the things that we know about anxiety is that when we know about anxiety, it does kind of help reduce some of those symptoms. And so I think it's good to talk a little bit about just how we see anxiety. Uh, what we have here, it exists now, it's rooted in the future, and it can grow from past experiences. What we experience is definitely something that we experience in the present. When we have anxiety, when we have certain feelings, certain symptoms that crop up, those are things that are very present, very real in the moment. But anxiety is something that's always going to be rooted in the future. And we'll get to a little bit more of that in a second, kind of how we can tell when this is anxiety versus when it's more of a fear experience. And we have anxiety based on past experiences that have come up that say, hey, this may happen, this may not happen. We have instances of anxiety or things can kind of decrease at times. Sounds like we're getting a call there, maybe. All right. So a minute ago, I mentioned some of the ways we can look at anxiety versus fear. When we ask ourselves the question, is this anxiety? Sometimes we can get confused. We have those same feelings physiologically a lot with fear and kind of some of the same types of thoughts when it comes to, like, say, racing thoughts or things that are intrusive. So I've got a brief questionnaire here, and I'm going to ask Mike to participate in this with me. Um, let's look at this and say, if it's fear based, that's something more present. If it's anxiety based, that's going to be in the future. So, Mike, if you were to see a bear in the woods, does that feel like it's something that's more fear or more anxiety?
Would be fear.
Yeah, that's right. So if we see a bear in the woods, that's going to strike that fear that's going to cause us to have a reaction right now in the moment that's going to be preservative. And I think that's the big word we're looking for here. It's preservative. It's something that helps keep us safe. Uh, what about the possibility of seeing a bear in the woods?
Anxiety?
That one is anxiety. When we think about those possibilities, the potential, that's kind of the key there, that this may or may not happen. It's something that could be based on an experience where we've seen a bear in the woods. We get close to the woods, we have those fears, but, those are not necessarily actual, real, in the moment preservative feelings that we have. Those are, again, those are very real feelings, but those feelings of anxiety are based on something that's potential, that could or couldn't, may or may not happen. What about being mugged when you're in the city?
Fear.
Fear. So that one's definitely something that if it happens to us, we would experience some sort of fear in that moment. And what about the chance of being mugged in the future?
Anxiety.
Anxiety. So if you'll notice the theme pattern here, everything on the left side of the screen, these are things that, in these examples, these are things that are happening in the moment. That's where the fear is, versus and on the right hand side of the screen, those are all anxiety. If you notice, there's possibility, chance, possibility, chance. These are all things that could potentially happen, but they're not a guarantee. The ones on the left, those all lend a lot more toward preservation. Those are the things that cause those fight or flight or freeze responses that are meant to protect us. They're not the things that are meant to stop us from doing anything. When we think about anxiety and fear and all the related words, we do have what we identify as kind of an optimal level of anxiety, and this is kind of the space where it drives us towards something. If we are going to rate our anxieties on a scale of 0 to 10, 0 being no anxiety, 10 being the most we can imagine, we can think of it as when we're at a 10, we got more stress than we can imagine. Things are just too hard to handle. We can't cope. It makes it almost impossible to get anything done. On the opposite side of that scale, when we're at a 0, we're basically just going to lay face down on the floor all the time. It's kind of laying around like a slug, not getting anything done. We're certainly not going to get up and go pay our bills, pick our children up from school, those kinds of things. When we look at this optimal level, it's not going to be on the higher end. It's not even going to be in the middle. We're kind of in that bottom quarter, around a 2 or a 3, where that's the kind of anxiety that we have that's just a little bit there that helps us kind of look to the future and kind of drive toward it on our own, where it helps us succeed at work, succeed in business, helps us do things like get homework done, get our bills paid on time. I think I've said that a couple of times. You can tell where my priorities are here. Just kind of driving us forward to do the things that we need to do, and it changes that I can't to an I can. We're to 0 to 10. We do certainly feel like we can't do things. When things kind of lighten up, we turn that around and can focus on I can once it's at a manageable level. The key here is manageable level, I think. So when we talk to ourselves about anxiety, I think it's important to recognize what our symptoms are. We don't always have those same symptoms of anxiety. So sometimes, we look at what's going on with ourselves and then we say, okay, what kind of things am I experiencing that I associate with that? Is it something physical, something physiological, something emotional? I don't know. Ricky, Mike, what kind of things do you guys experience with anxiety? Kind of feelings?
I definitely will at times have a rapid heartbeat.
I mean, a rapid heart rate, I think it's a big one. Mike, anything?
I've had just a couple of times where maybe it's like extreme anxiety where I almost get like a little bit dizzy, lightheaded.
Absolutely. I think lightheadedness can certainly be one that pops up. Of those racing thoughts that we'll experience, the kind of churning in your stomach, the muscle tension you get in your back, or just different things like that. Um, when we recognize those symptoms and can identify that as anxiety, I think we have a few different options for ways we can approach it. One thing, we can always ask ourselves what happened. That's something that really helps lead to more exploration of what some of those things are that I guess produce the anxiety, so we can attack it at the roots. Another thing we can ask as far as like whether or not this is anxiety, we've got our questions from earlier around the fear versus anxiety. I think if we ask ourselves, is this helping? When we say, yes, this is helping, I see a bear, I run the other way, absolutely it's helping, then we know we're on the right track. But if not, if it's not helping, if it's hindering, that's when we can do a few other things behavioral health related. We got a few different things that we talk about typically with patients here in behavioral health, like our grounding techniques, breathing exercises, muscle relaxation. Also, we have different kinds of visualizations that we'll walk through together. meditation, just some things like that. So Mike and I are going to run through one of these real quick and just kind of demonstrate how this works. So this is my favorite grounding technique, and it's something that's really intended to help bring you to the present, help focus on just the things that are immediately around you, to take away from all that future thought. So Mike, if we could go through this real quick. Starting out using our five senses, we're going to look at what we see, what we touch, what we hear, what we smell, what we taste. So what are five things you can see right now, just things around you?
Sure, I can see a computer screen. I can see a wall beyond that. I can see a light fixture. I can see the ceiling that the light fixture is attached to. I can see an air vent on the ceiling.
That's excellent. And I'm glad that you did it like that. I really appreciate the way that you said, I can see at each one of those. I think it's important to walk through those with those words at all times too. Just kind of describe to yourself what you're able to see. And those are definitely things that are just present right now. You didn't walk around and think about it too long, didn't just notice them, but just experience them. What are four things you're touching right now?
Four things I'm touching. I'm touching the chair that I'm sitting in. I'm touching between that, I'm touching the clothes that I'm wearing. I'm touching the floor with my feet, my shoes, and I'm touching my desk as well.
Great. And those are things that you just kind of notice and recognize. What are three things you can hear right now?
I have to really focus on this. This is kind of a quiet office. It's all background noise. I can hear in the office next to me, it sounds like a fan motor blowing, and I can hear the rain outside right now. And I have a clock on my wall. I can hear it ticking.
I think this is a great example too. Sometimes we do have to be patient for this one. An example that I like to use is if I only hear two things, I can always wait until another thing kind of presents itself. Sooner or later there'll be a car drive by or a bird will chirp. Right now we'll hear some lightning. There'll be something else present itself. Those are great. What are two things you can smell?
I don't. That's even more difficult. It's a pretty clean office. There's not a lot of smells to be had in this office. It just feels like maybe a sense of some cleaning materials used on the carpets.
Sure.
That would be about it. I'm kind of struggling for two things.
Well, so I think this is one where, anytime we're anywhere, we can smell our environment. Just take that deep breath. You can smell, this room has a room smell. We don't have to be too descriptive. Just, that's what the smell is. If we're outside, it smells like the outdoors. And if nothing else, we can always reach down and smell our clothes, smell your shirt. And you kind of get the whiff of detergent, or if you've been cooking, you'll get some sort of food residue that's kind of left lingering there for the aroma, or maybe your sweat. But those are some things that we can reach out and do. And what's this last one here? What's one thing you can taste?
Well, I have a mug of coffee in front of me, and so that is what I taste right now is coffee.
That's great. That's fantastic. I think anytime we have anything like that we can reach out and grab. Sometimes we'll have kind of those remnants of things we've eaten, some toothpaste lingering from when we hopefully brushed our teeth this morning, those kinds of things. But really, if you got nothing else, we can always go find a glass of water, have a sip of water, have a sip of coffee, things like that. So, well, that's great. I appreciate you helping me out with that, Mike. Next thing we'll hear, I'm handed over to Ricky. We've got the visualization to run through real quick.
Okay, thank you. So we're going to be looking at guided visualization or creating a special place. What we're looking for here is to maybe sit back in your chair, maybe close your eyes if you're comfortable, and walk yourself through a special place that's meant for you. Go to your safe special place, lie down, be totally comfortable, or if you're in your office, then lay back in your, or sit back in your chair. Close your eyes if you're comfortable. Walk slowly to a quiet place in your mind. Your place can be inside or outside. It needs to be a peaceful and safe place. Picture yourself unloading any of your anxieties and worries. Notice the view in the distance. What do you see? What do you smell? What do you hear? Notice what is before you. Reach out and touch it. How does it feel? Smell it. Hear it. Make the temperature comfortable. Be safe here. Look around. A special spot, a private spot. Find the path of this place. Feel the ground beneath your feet. Look above you. What do you see, you hear, smell? Walk down the path until you enter your own quiet, comfortable space. This is a very short invitation to the special place or guided visualization. You can make this as long as you like, or a short 5 minutes or 30 minutes. Please enjoy.
All right. Is there anything else, guys?
No, I think that just about covers it for me.
All right. So if we really appreciate everyone's attention and time, and if you would like to reach us, you can find our contact information on the CPN homepage. It's always there. Or you're welcome to give us a call at 405-214-5105, or you can visit us, given that the doors are open again, 26 Father Joe Murphy Drive here in Shawnee.
So, Mike, I think the number's actually wrong. That was my mistake. It should be 405-214-5101.
Oh, okay. I noticed it. I thought maybe it had changed. That's why I just went ahead and went with that. So, okay.
Should
Yeah,
be 01. So my mistake.
All right. So if anyone calls us, please call. Here we go for the change. 214-5101. Thank you all again.
Thanks a lot.